true. And okay, I welcome you all for today's community health session with Enajuri. For those friends who are joining us for the first time, let me share what Enajuri is all about. Enajuri is a non-profit organization that engages in and promotes various initiatives that are striving for social change, honing leadership skills, and building entrepreneurship capabilities in the Northeast, including Assam. For the past few months, we have been engaging with speakers from various fields via virtual media to create a network among the people working in the region. Now, as we know, the fear of COVID-19 loomed around us. People avoid stepping outside, even for something as essential as their medical appointments. But thanks to the telemedicine and online health applications for being our knight in the shining armor, these online platforms are helping millions of people get easy access to healthcare facilities and consultations from the safety of their homes. So today we are honored to have with us Ms. Vinita, founder of one such application, Dr. Prax, which is a continuous health management platform. I, your host for the evening, Kavita, invite and welcome Ms. Vinita today to please give our audiences a look into your Dr. Prax application. I welcome you, ma'am.
Thank you, Kavita. It's a pleasure to be here with Enajuri. I'm extremely proud of the work that you are doing in the Northeast region. And I hope you're able to impact not just the Northeast, but the entire country. And I am extremely pleased to be here. Thank you very much for the opportunity to present Dr. Prax to the entire Northeast region.
Yeah. So, we'll start with something we would like to know how you got into this IT sector that you're working with 500 Fortune 500 companies. So, how did you start your actual studies, and did you plan to come into IT field like this?
Yeah, I actually,
From your childhood?
technology is something that had fascinated me even when I was very young. My father was an engineer, and he always was, fixing things, repairing things, and it was very exciting for me. And when I was in my 8th standard, I attended a small course. Somebody from Apple had brought in an Apple computer and explained us the basics of programming. And since then, I was so fascinated by technology, by hardware and software. My initial inclination was towards hardware, but then I saw what software could achieve. This was many years ago, almost 25, 30 years ago. And that's when I decided, when I was in the 8th standard, that I wanted to do something around technology in the computer space. And that's how I got into engineering. So I did my engineering from Pune University, and then I did management in the University of Minnesota. I recently have done, artificial intelligence and machine learning at BITS Pilani. So it's been an exciting journey with computers. I have had a great time. Thank you.
Okay. So you're still into learning and gaining knowledge about the machines and things that you're learning and trying to do these applications. So what it was actually, what were your goals that you wanted to come out with your career? I mean, like the same way that you said you studied from 8th standard, you knew that you wanted to come into this.
Mm-hmm.
So you wanted to make your career you had.
Yes, I was always, as I said, fascinated. I started my obviously I did my engineering, and as like any other young person, started with the job. I worked with many companies. I worked in India. I worked for the state of New Mexico in the US. And as a natural progression of my career, I traveled to the US. I was working with many different organizations there. I worked with, and of course, Fortune 500 companies, Fortune 50 companies, such as Intuit, etc. I moved back to India in 2008, and I was part of Persistent Systems. And that's where I worked again with a lot of Fortune 50 companies. I then looked into digital transformation, which are technologies that are cutting edge, transformative in nature, such as you all are aware of social technologies like Facebook, etc. Then we have mobile computing. Everybody uses a mobile nowadays. We have cloud computing, which is data on cloud. And then we have blockchain, machine learning, all these technologies coming together. They are different, they're just words, but eventually these technologies help simplify business processes, make the use of technology better in every area aspect of business that we are involved in, right? It could be finance, it could be healthcare, it could be networking, it could be any other phase. Technology has touched every part of our life. So I looked at how we could use these transformative technologies across different business domains. And one of the things that really fascinated me was using it in healthcare, because I still feel while, in healthcare, they're using technology for core healthcare applications where, they are doing a lot of hardware engineering and computation is used while doing surgeries, etc. It's not touched the day-to-day lives of doctors and patients at a core level. And that's how I kind of have been fascinated by technology and healthcare for a long time.
That's good. That's very nice, because nowadays even children are opting. It's been so many years, like 15 years now down the path. We have seen that children are opting into this IT sector, and then there's so much scope to go and do some great things in the application sector, developing new applications. So, how did you start developing this healthcare system? Your mentors, your friends, or your advisors were there with you? Somebody who was there?
So, as I said, I was always technology and healthcare was always something that was on the top of my mind. And unfortunately, I went through a fairly my journey with Dr. Prax. It emerged from one of my own personal needs. So there's a very close relative of mine who actually went through a very difficult healthcare phase. So he has a chronic disorder, and because of that chronic disorder, he ended up having a craniotomy. And because of his underlying health condition, it was a very complex case. And we were working with 5 different specialists. We were working with rheumatologists, cardiologists, nephrologists, every possible logist we were working with in kind of ensuring that his treatment and cure was moving in the right direction. One of the biggest things that I realized when we were working, when that happened, this happened sometime around 2016, 2017. And at that point of time, I realized that the capability to connect the doctor and the patient, while it is, today we all are using archaic methods like a phone, right, to still talk to, and that's a one-on-one medium. If you need to connect a group of doctors together while they're treating a patient, there's no such technology that is available today. We need to get everybody together on one page while treating a patient through a complex case. So then I did some research, and now if you look around us with our lifestyles, with our stress levels, almost every person, at least you have one person in your family who suffers from a chronic disorder. It could be diabetes, it could be heart disease, it could be an autoimmune disorder. And when somebody unfortunately faces these kind of ailments, typically they are not dealing with one doctor, they're dealing with multiple doctors. And if you go to that doctor, that doctor treats you based on his specialty, right? He does not know, are you doing any other lifestyle changes? Are you exercising? Are you following any diet plans? He'll tell you, yeah, you need to take care of your diet, see a dietitian. But what exactly is the dietitian doing? Are you following that diet plan? Or if you have an autoimmune disorder or where you're seeing a rheumatologist and it is impacting your heart, so because of that, you're seeing a cardiologist. What treatment is the cardiologist giving you? What kind of treatment is actually working for the patient, even during pregnancy? Okay, I mean, I think you have a child, right? So when you're going through pregnancy, at that point of time, you need a diet plan, you need a physiotherapist. Sometimes some women are suffering with diabetes, in which they need to see an endocrinologist. These people need to work together while treating that lady. And if that communication mechanism is established, they don't need to kind of study it in detail, but if they at least have a awareness of what's going on at a holistic level, it's so much better to treat the patient. That's number one. Number two is there are a lot of monitoring devices that have come out now. So people are monitoring SpO2, very common because of COVID. People monitor their blood pressures, they monitor their sugar levels, but they're not tracking it, right? So the doctor does not know that whatever treatment they are doing, is that progressing in the right direction? Are the patients really getting cured? So with technology, we can do that very easily. And that's the platform we are providing through Dr. Prax.
Okay, that's very, very interesting, and that's the need of the hour today. I mean, keeping your parameters in the right. How do you know unless and until you're tracking what is going on with you? So, like in day-to-day life, also nowadays our life has become like this, that we have to keep track of our parameters. Whether it's your temperature, your daily sugar, pressure, everything has to be under control.
Even
So
simple,
this is, yeah.
simple things like your weight, right?
Yes, yes.
You know, it can help. It'll help you achieve certain health goals that you want to achieve. I'm sorry for interrupting you.
No, no, it's all right. That's what I was saying. Yeah, that is a very good thing that you have come out with. But how do we connect and how do we go to this Dr. Prex now
It,
that we
it's very simple. I'll quickly walk you through our website, which has all the details about the application. I'll just share my screen. So this is our website, drprax.com, drprax.com. Can you see my screen? Can you see my screen, Kavita?
Yes, yes, yes. We are able to see.
Okay. So this is our website. And as I mentioned, this is an application for doctors as well as patients to use. Okay. This application is available on your mobile. You can just go to either your Play Store or your App Store and download DRPRAX. And as I mentioned, it allows new age health management where you have a more holistic care for yourself. There's continuous digital care because you are constantly connected with your doctors either in their clinic or remotely. Obviously, since you're connected with your entire healthcare ecosystem, it's a long-term relationship. It's not like a one-time care. You go visit your doctor and then you're done. And our focus has been on patient satisfaction. The patient has to feel comfortable about using and has to feel comfortable that they're getting the right help from their healthcare ecosystem. And our focus has been on medico legal safety. So we are regulatorily compliant. And we have worked closely with medico legal experts in ensuring that we follow all medico legal compliance parameters, whether it's for doctors or for patients. So as I mentioned, it is about improving the doctor and patient engagement. I'll quickly tell you how it helps patients, right? So basically, it allows patients to take care of their health. Okay, they can maintain their entire health history. So whether it is their previous, whether it is their all the prescriptions that they have received in their lifetime, they can store those here so that there's a reference to what kind of treatment they have received in the past. All their medical records. So a lot of times you go to a lab, you get certain blood checkup or your health checkups or diagnostic reports, and they are sitting there in some file. You can now store them all and maintain your complete health history for your family. You can follow up with your doctors either on your either you can go in their clinics, take an appointment. You can take appointments for in clinic consultations or remote consultations. You can take those very easily. And the third thing, as I mentioned, you can track some of your important parameters that will help you stay healthy. So this is what we offer for patients. One of the biggest advantages is sometimes you go to a doctor and you see a doctor and the doctor asks you to run some reports. The doctor has seen you, right? And then when you run the reports, you have to go back again to the doctor's office to show those reports. And then the doctor, kind of prescribes certain medications based on your parameters. Now, the doctor's already seen you. With Dr. Prax, you can share those reports online and you can consult with your doctor remotely. You don't need to. So you save your time and money in actually traveling to the doctor's office and back. And you can, whether it is retitrating some of your medications are there, and maybe, you need they're not working for you, you need to discuss that with the doctor. Or you have certain side effects that you're seeing because of the medication. You don't have to run. You can just, send a message to the doctor, and it is maintained as a part of your history, and the doctor can treat you correctly. So I think remote consultations, even and today, especially during COVID times, you don't really have the time to, visit the doctor's office with the, you're trying to maintain social distancing, you're trying to stay safe in your home. Remote consultations have played a huge part during these COVID times. Similarly, we have, as I said, the application for the doctors. For doctors, they can manage their complete practice digitally. So what they can do is they when the they can book, they can schedule all their appointments, the timings that they're available both in their clinic as well as remotely. They can basically set up all that time on the application, so patients can come into book appointments in advance and come into their clinic. So the entire OPD management, that their whole clinic management becomes much easier. They're able to set up a complete digital practice in less than 15 minutes if they decide, once they start using Dr. Prax. And also, since the patient is now on the platform, they can always remotely connect with the patient over an audio call or a video call. Now, we have seen certain doctors, their patients are not that educated, or they are from rural regions, but they still need to consult or help them. They can always book audio appointments with them and call them, where the patient does not need to actually download the app. They can just book the appointment and call the patient directly on their phone line. And we maintain the doctor's privacy because the doctor's phone number is never shared with anyone. So the call actually goes to the patient over a mass number. So these are some of the few benefits that I'm enlisting, but it definitely helps them acquire new patients, stay engaged with their patient, and retain their patient for a long period of time, because the patient feels secure in consulting the doctor, because they know the doctor is always available, either in their clinic or remotely. So this is it. This is pretty much what we have around Dr. Prax. And I would encourage you to download it either as a doctor or as a patient and use the application.
Yeah, this is very convenient. What I got to know about doctors, for the doctors also, and for the patients also, this is a very convenient place to be. Doctors can, of course, reach out to so many people out there, and patients sitting at their own confinement area, they can actually get all the facilities and consultations, what is required. And the best thing about this is that it's a secured kind of an environment. Absolutely. Where we have seen still in our regions, Indian mentality, like that women will always prefer to have a close kind of a secured kind of an environment to speak to a doctor. And maybe here they can have their own privacy, and then they can share their own things with such doctors. So how do you deal with the challenges that come into for security, and some solutions that you have to take?
Sure. That's an excellent question, Kavita. So we have taken a lot of care in ensuring that the application is secure, both for the patient as well as the doctor. We have maintained complete privacy. So the entire system has been built using systems where security plays a center stage. The payment gateway that we are using is a PCI compliant payment gateway. And as far as the security is, the patient, only the patient owns the data that sits on the platform. So if you upload your reports, you decide whom you want to share the reports with, whether you want to share it with Dr. A or Dr. B or Dr. C. And nobody has access to those reports, not even my team. So it is all masked, it is all encrypted and securely stored on the cloud, so that nobody has access to it except the patient and the doctor whom the patient wants to share the prescriptions or reports with. So that is something that we focused on: medico legal safety and security. is the center stage while building this entire application from day one.
Okay, so this is the solutions that you have come out. So these are the pros, but we'll go into
all the security protocols that need to be maintained and managed have been incorporated into the systems.
Okay, okay, that's great. That's great. And what about the if somebody, like you said, in the rural areas, if someone like they don't have Android phones and then they don't have, so if they log in from a different phone, maybe a neighbor has in practical sense, a neighbor has something, a good phone, Android phone, where he can reach out. But then the patient will, then this person will have an access to their details in his phone.
Yeah, actually they do. They will, because we are using phone number and OTP as a security measure for the patient to log in. So suppose they go to their neighbor's phone and they log in with their phone number, which is a not non-smartphone, and then they will get a OTP on their phone, which is sent via SMS. They log in with that phone number and OTP. They communicate with the doctor and they log out. In which case, their neighbor will not have access, because until the neighbor signs on again with his or her phone number and OTP, they'll not be able to see those.
Okay, okay. If they don't have a smartphone, then also it's I mean very much compatible. The whole system is compatible.
Correct. And what we are doing for people who do not have smartphones, they can call up at Dr. Prax, and we are doing this for corporate employees also. So there are a lot of corporates who are signing on to corporate programs with us for their employees. Now, some of the employees are workers where they may or may not have a smartphone, but they are not comfortable with using technology, but they need the healthcare, right? So in which case we are giving them a customer support number, and they everybody can dial a number. So they call this customer support number and say that this is my phone number, and I need to book an appointment with a general practitioner, or I need to book an appointment with a specialist. Can you book that? So what this our customer support does is sets up the phone number and books the appointment for this patient, and the doctor can call the patient directly over an audio call. And as I said, it's a mass number, so the patient gets the service, but then he doesn't have to download the app. He or she doesn't have to download the app.
Okay, in that case, it's quite easy for them to do it.
Correct. But our application, I think you asked me what have been my learnings around Fortune 500 companies. I think when we spoke earlier, you had asked. So I see there are three things that I have seen, whether you're building large systems or small software systems. One is the system should meet the business needs. Okay. It should simplify the business process, whatever process, whether any user is using, it should simplify that process. And third, it should be easy to use. So the same principles I have employed while building my application, that it has to be very, very simple to use. And that being said, we have a lot of rural patients who are actually using the application because it is modeled around WhatsApp. Everybody knows WhatsApp, right? So they can also use our application. It's that simple. And they are writing messages to their doctors in their own language, because the keyboard supports any local language, right? So they can communicate with their doctor in the local language, and the doctor responds to them, sends the prescription, everything. So right now technology has become very ubiquitous. It's everywhere and everybody's able to use it. We have a lot of rural patients because we have rheumatologists, we have infectious diseases experts who are in urban areas, but they have patients, in remote areas of Maharashtra who need help, and they can't travel every time. So they talk to the doctor, they send a message, and they get the required help.
Okay, that's great. Very friendly. I mean, it's a user-friendly kind of an application. And now I would like to know how, what is the process? How do the doctor if from Northeast wants to join in your application?
Yeah, I'll quickly share my screen to show you once again, what I have.
Yeah.
And it's that simple. It pretty much, they can do it in 15 to 20 seconds. Okay. So once they download the application from the App Store or the Play Store, the name of the application is DRPRAX.
Yeah.
As soon as they download the application, this is the landing screen. Okay. Where you can sign in either as a doctor or as a patient. So it's the same. It's the same application for both doctor and patient. We do not have separate applications. It's just the views once you log in are different. Once they get onto this screen, they have to enter their phone number. So they enter their phone number and they log in. Once they log in, an OTP is sent to them via SMS. They enter the OTP and they are into the system. Once they enter the system, they just have to set their profile. In the profile, they have to set up their personal details, their professional details, their clinic details, and they are all set to go. And as soon as they register, we'll have somebody from our team who will call the doctor and guide them through the entire process. And it's the same for the patient. So as I said, once they are in the system, it's very, very easy to use. A lot of times doctors have started using it even without requiring any help from my team.
Okay, that's very good. And I hope that we can access this facility and everyone gets benefited from this. From our northeast areas also, maybe you'll be getting people.
Absolutely.
Yeah. So, Acha, tell me one thing. I was very interested in one thing when I was going through your details. I saw that there was a investor track achievement that you had got. What is it all about? I really want to know about you. Okay, what was it that you were in the first top 10 investor track people? No, you were selected for that.
Yes, yes. So we were among the I was selected by the Head Start organization as the top 20 women entrepreneurs, and also by Zone Startup and BRT SIF. They had an accelerator program, incubation program, for which I was selected, and they have been guiding us through the investment process. We have been able to raise funds from, of course, friends and family. But one of the biggest achievements we've had is we've also been able to raise funds from doctors. So doctors have invested in our platform because they believe that this is the need of the hour, and they have been very happy about with the progress that we've achieved through the platform. So today we have close to 1,500 doctors registered on the platform and close to 50,000 patients. And this has just been in a matter of about 2 years, 2.5 years. And literally we have done very, very less sales and marketing. I think we have spent less than 3 to 4% of our funds on sales and marketing, because we wanted to ensure that the product meets the criteria, is able to serve the user group. And now that we feel that we have a fairly solid and robust product, and patients, doctors are happy using the product, we are now going to focus on sales and marketing to expand the reach and get more people to benefit from our product. Kavita, did I lose you? Hello?
Okay, that's very nice. Yeah, no, yeah, hello?
Yes, I'm
Can
ready.
hear me? Yeah. Okay, so this is something that you had already achieved working here. You were in India, or you were working outside?
No,
You
right.
were abroad
In India on Dr. Prax.
in India. Okay, okay. So and now, what are the new initiatives that you have come up during this era of going on this pandemic? So as we know, this is quite user friendly that you all had started quite before the pandemic.
Mhm.
But how has it helped in another way to come out in this pandemic?
So, see, what happened is when the pandemic started, that this second wave. So last year we saw a huge surge of activity on the platform because doctors were more open to use technology. So doctors are typically, they are always focused on their patient and treating their patient, and technology sometimes they believe it as a hindrance. So they are a little averse to technology. But when COVID hit, a lot of doctors and patients have started adopting technology, trusting technology, and platforms such as ours to help each other. But that was during the first wave. So we saw a huge surge in activity. With the second wave, I think, we all have, it's just been like a crazy time throughout the country. I think we all are aware. things have gone pretty much haywire. And there are a lot of fears and anxieties that have been created in the minds of patients while they're receiving, like, there's a minor fever. Do I have COVID? Do I not have COVID? If I have COVID, should I get myself tested? Will I be isolated? So there's so much of fear going on among everybody. Now, once they get COVID, sometimes it's a mild version of COVID, but then the patient goes through immense amount of anxiety and fear that, oh, I have COVID. What is going to happen? Is it going to impact me? How is my, is it, am I going to kind of pass it on to my family members? So there's mental health issues, there's anxiety. Then sometimes they don't want to get hospitalized because of the same reasons. And then you have the other group of patients who basically feel that, I have COVID and oh my God, it's like I'm just going to die. So I have to go to the hospital. And he or she could have a mild version of COVID, but they're rushing to the hospitals because, they believe they need to protect themselves, and fairly enough. But then what happens is when these people who have mild COVID and they're rushing to hospitals, they're taking away the opportunity of a hospital bed for someone who critically needs it. So we saw these two variants of patients who either are not getting the right treatment, or patients who are so fearful that they're rushing to hospitals even when they don't need to and can get isolated at home. And we felt we wanted to get the medical advice to them. So we decided to create a free COVID program, complete free home isolation program for mild patients. I'll walk you through that program. The details are there on our website. I'll just quickly show you.
Yeah, definitely.
Easy to, can you see my screen?
Yes.
So this is the COVID-19 care. It is completely free COVID teleconsultation program. We don't expect the patients to pay anything to register or enroll into the program, and it involves up to five consultations with a general physician, that is a doctor who will treat them with the entire COVID, give them the medical treatment. There's also a dietitian consult that we arrange for patients that need it. So if you're worried about your diet, a lot of people have questions. Can we eat this, or do we need to be on a high protein diet? What kind of supplements we need to take? There's a dietitian consult that we also provide. In addition to that, there are patients who are going through deep psychological issues, right? They are fearful, they are anxious. If they are not, their family members are. We're also providing a psychological consult. So this program entails all these three components. And if any patient believes that they are mildly sick, or their temperature is at, they may have a temperature, but it's the controllable level. Their oxygen parameters are above 94, 95, and they're sick but not deeply so, and they need guidance from a medical expert. They get 7 consultations overall, and if they need more, we'll be more than happy to give them more, because we do have the capabilities, we have the infrastructure to support them. So I would encourage them to use it. Please help yourself, please help our entire medical ecosystem. Let's do the best we can, and cure ourselves as soon as possible. Also, we give you guidelines on what you need to do during home isolation. As soon as the patient enrolls, we send a complete guide on how they need to take care of themselves, guidelines for the caregivers, and what are the alerts that they need to watch for if they need to get hospitalized. So we handhold them through the entire process, so that they can safely get cured at home. So the only eligibility that we impose is that they should be positive, COVID positive, or they don't need to have a report. If they believe that they have COVID and they need even the first consult, we are willing to give them that. They should not have any comorbidities, because that it's very quickly, it can escalate into a complex situation, and we want the patient to not be isolated if they don't need to be. So they need hospital care. Their oxygen levels have to be 95 plus, and they should be willing to monitor their health on a daily basis. Also, they need to have a caregiver at home. These are some of the eligibility requirements that we ask for when we enroll a patient into this program. So this is open also for, the Northeast patients. So please feel free to, avail these services, and we will be more than happy to help you. So this is a completely social initiative, Kavita, and yeah, please pass it on to anybody who can make use of it.
Yeah, definitely. That's why we wanted you here on our platform. This is such a nice thing to have. And in Northeast also, some initiatives have come out with these for during the COVID. The doctors are trying to come out with solutions like this. But then this is very good. We wanted to know how it is how can we register, and how a normal person can also come for like you said, in general health also it's very helpful. Okay, now I wanted to know how I mean, is the doctors in general consultation, I'm saying, like for COVID, so you have kept it free, so the doctors they are not charging anything in the COVID consultation, but
Correct.
what about the general like OPD that you have?
Sure, I'll just cover that. Quickly, I want to just say that if patients need to register to the program, if they go to our website, drprax.com, and then they click on COVID-19 care, they can go here and there's a registration link, which will take them to a form where they need to enter the details, and once they enter the details, they can sign on to the program. This is the registration form, and they can sign on to the program. Yes, and this for COVID-19, it's completely free, as you mentioned. We do not charge for the consultations, but normally we let the doctors decide what they want to charge for their consultations. So if it is a consultation for an endocrinologist or a cardiologist or any other doctor, and it is a regular non-COVID consult, doctors and patients can register to the platform, and they can do video consultations, audio consultations, or chat consultations. For chat consultations, the patient can send a message, and the doctor can write a prescription for the patient. If the doctor charges for the consultation, for the prescription, there's a very easy way to do it, and we walk the doctor through how they can write the prescription, or if they need a patient to consult, we can guide the patient to when the doctor writes a consultation for the prescription has to be paid before the patient can open it. And what the doctor wants to charge is completely left to the doctor. So if the doctor wants to give a free consultation, they can write a completely free prescription without charging a dime, and in which case it's nothing. And if the doctor wants to charge, say, 100 rupees, they can charge 100 rupees, and until the patient pays 100 rupees, the prescription will not be seen by them. Now, for audio and video appointments, the doctor has to just set their schedule as to when they want to allot time for the audio or the video appointment. Once they set up the schedule, then the patient can book the audio appointment and the video appointment with the doctor, and they have to pay before they book that time with the doctor. So that's how it normally works. Did I answer your question, Kavita?
Yeah, that's it. So, yeah. So this is how it works. But I mean, whatever they are prescribing, if there are some test reports, like a scan has to be done, or something, a blood test has to be done. So the prescription, then after taking out the prescription, they can go and get those things done. I mean, even they don't need a verified. I mean, a prescription like that, or they can print out and then give it to you. What is the procedure?
That's a good question. The prescription is an MCI approved format. It includes all the fields that are required in a normal prescription, which involves the RX details in terms of medications that are prescribed, the dosages, the timings of the medications, and any instructions that they may give. It also includes follow-up details, as well as details for investigations, like you're talking about. Like if the doctor needs to, needs a blood report or a HbA1c report, they can write that in the prescription, and it is the doctor has to sign the prescription on our platform before they send it out. So the sign and the stamp of the doctor is there on our prescription. So the patient can either show that when they go for any kind of investigation or diagnosis, or they can also take a printout and share it and go and get it done. So it's like any other prescription because it includes the signature and the stamp of the doctor that has prescribed it.
Okay, that was very necessary to know because yeah, once when we go out and do our tests, then we are required to show that
Yes.
proper thing. Yeah.
Yeah, they are honored. They are honored. These prescriptions are honored because they're in an MCI approved format. And as I mentioned, they have all the important aspects that are required or that have been mandated by MCI. All those fields and all those details are present in our prescriptions.
Okay, okay, that's very good. And this is how you have been working like in the healthcare sector. Is there any other way you have been doing some new developments in this? Is there something new that you are doing other than this?
So in the healthcare sector, of course, we are helping the doctors, the patients through this. Now, an extension to this and the COVID-19 program, an extension to this that we are offering is for corporates. So a lot of corporates, and we are not talking about the large corporate which have, 2000 plus employees because they have signed up with insurance and they have, required healthcare support provided to their employees. But to corporates, we are offering a plan where they can offer healthcare support to their employees at a small amount. We are able to give all general physician and specialist consultations to their employees. So it's a huge retention factor for employees. It gives the employee the comfort and satisfaction that they have healthcare access easily available and they don't have to spend a dime. And of course it's a benefit that employees can provide to their that employers can provide to their employees or corporates can provide to their employees over a long period of time. And this is something that we have been able to provide recently. So it is related to healthcare, but right now Dr. Prax is something that I do almost I wouldn't say my family says 200% of my time. They're like, any borrowed time, you give it on Dr. Prax, and that's exactly what I'm doing.
Okay.
It's just working around how we can, improve healthcare and make it accessible for everybody, including rural patients or, even workers of companies or corporates that do not easily have access to healthcare or are worried about healthcare.
Yeah, that's very nice. And what about these people that I mean, you've got a team of them. So how do you? There are more partners with you. So what is your team that consists of? How many of you are there?
So as far as my partners are there, I have Atul Shah, who's a partner with me, and we also I have my VP of engineering, Guru Raj. So Atul Shah helps me with a lot of marketing activities and we pretty much work together. Guru Raj completely takes care of our technology platform and all the requirements that we get, or as we evolve the platform, he pretty much focuses on managing the tech team and evolving the platform to meet the requirements of our users.
So something that you would like to share for the coming up developers, like the application that you have founded?
Yes, all I would say is when you're building your application from a development perspective, and this has been my learning, with 25 years of experience with technology. So when I started building applications, we used processes like waterfall, where we found all the requirements that the users had, and once we had them all documented, then we would design the system and then we would build the system. But by the time we built the system, the requirements had changed, and then we went back into a process of building. So what we have employed, and which is being widely used nowadays, is a process called agile development, where we kind of understand a broad level. We have a broad level understanding of requirements. We build the system to meet the requirements at a basic level, and then we enhance those features as and when the users start using the application. So the time to market is very, very quick. So I would encourage be very, very close to your users, understand what they want, and try to build systems that do not feel like your users are using technology. They should feel that it's part of their everyday life. It is easy to use, and you keep the user at the center of your application, rather than as a peripheral where you're building the system, you're focusing on that, and then you go to the user once in a while. Your user has to be center of your application while you're building the application for.
Very true. Very true. Very true. It should be like even children and everyone, they should be able to uh, use that very friendly kind of a way. Okay, maybe we have some questions here from our team, Managery team. In Prayashi, you're there? Okay, Milanji is not there today. I suppose they are not here from our, yeah. So, okay, thank you very much, Vinita. And we really hope that this is going to be, I mean, I know that this is very, it's a very user-friendly app, and we all need these kinds of applications every day in our daily life. And after the pandemic that we have seen is life has changed a lot in a way that we are getting into online for everything. Internet, if it's available, wherever it's available, then this is such a good thing to have on your phone.
Absolutely.
So thank you so much for being with us today. And I know how you have squeezed this time to spend with our audience here. And I hope the friends who are listening to us and then who are going to follow up with the app, they'll be benefited in a big way. Thank you so much for joining us. And we'll keep in touch and keep hearing, and good wishes for your more initiatives into this.
Thank you so much, Kavita. Pleasure to be here. And thank you for giving me an opportunity to present Dr. Prax to all of you. I wish you all a lot of luck too. And I hope you'll continue with all your social initiatives. And if there's any way we can help, do let us know as well.
Very, very, very. We are sure that our audiences are staying home, staying safe, and taking all the precautions that are needed to be taken during the crisis that we are going right now. We are into this, and we have to be very alert for our own surroundings. And like you said, that if we are able to take this treatment at home with mild symptoms, that then we are not creating a burden on the healthcare system outside. So it's better that we I'll just say in Assam is also, so that our people in Assam can go through this. So আশা কৰিছো যে সবে এইটো হেৰি কৰিব পাৰিছে যে আজিকালি যুগত এনেকুৱা টাইমত আমি ডক্টৰ প্ৰেক্সৰ নিচিনা এটা এপ্লিকেশ্যন ইউজ কৰিব পাৰো ঘৰৰ ভিতৰত বহি লৈ. So thank you so much, Vinita, once again. Hope to see you again. Bye-bye.
Thank you. All the best. Bye.